The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
Good evening friends, welcome to a new episode of BMC Global Live Hilal Health World, Nothing But Lifestyle. I am Anupriya Menon. In this talk show Health World, we have expert doctors from various fields providing valuable information and guidance to all of you to assist you in your journey towards good health. Injuries are a common occurrence in sports. It's a part and parcel of the game. It can happen to anyone, anytime. It's quite unpredictable and unavoidable. But for a sports person, it's extremely important to remain physically fit and to prevent injuries because their whole future, their sporting career depends on this. Sports medicine is that branch of medicine which exclusively deals with prevention and treatment of sports injuries. To discuss more about this topic, today we are joined by Dr. Dayal Chavan, specialist orthopedic surgeon from Al Hilal Hospital, Rifa. Dr. Dayal is a specialist in sports medicine. Let's go over to him and know more about sports injuries. Welcome to the show, Doctor, and thank you so much for joining us.
Thank you.
Doctor, when we talk about sports injury, the term that mostly comes up is ACL. We keep hearing about ACL, but I'm sure our viewers would like to know what exactly is ACL, what does it stand for?
Yeah. So ACL basically it is the anterior cruciate ligament. Before getting into the details of the ACL and its injuries, let us talk about the anatomy of the ACL and the knee joint. Okay, I will show in the knee model. So this is the model of the knee joint. So as you can see, the top bone is the femur and the bottom down is the tibia. So in between two bones, the structure cushioned is called the meniscus, and these two bones are connected by the ligaments, both in the front and the back. So the front one is the anterior cruciate ligament. So the topic for discussion today is the ACL. So this is the ACL. ACL, it is a structure connecting the top bone to the bottom down. And there is one more structure which connects the both top to the bottom down bone, that is PCL, which is behind, that is posterior cruciate ligament. So the anterior cruciate ligament, the length of the ligament is approximately, it is 3 to 3.5 centimeter in a normal individual. And one of the main biomechanics of the ACL is to prevent the anterior translation of the tibia to the femur. That means the translation movements of the lower down bone is prevented. That is the main mechanism of the ACL.
So basically it's about the ligament.
Yeah.
Okay.
It is the ligament which connects the
upper and the lower part of the
bone,
okay,
and which helps in preventing the translation movements of the tibia, so to have the stability of the knee.
So what is the mechanism of ACL?
So ACL, it prevents the translation movements. So you should have stable knee, especially for sports activities while running, jumping, twisting. So the knee should not wobble. Okay, and to have stable knee, fixed knee, so ACL is a must.
Okay. So that's why it's very important for all the sports persons to have a healthy ACL. So it can affect your balance and your movement, your agility, everything can be affected.
So once the ACL is damaged, the lot of surrounding structures, like one is the meniscus, what we call shock absorber in the knee, and the surrounding ligaments, the stress will be more on the structures, and over a period of time there will be wear and tear in these structures, which may end up in osteoarthritis.
Okay.
That is the reason why the ACL is very important for the sports individuals. Coming to the mechanisms of the ACL injury, the ACL is very commonly injured in non-contact deceleration and the jumping and the twisting injuries. So twisting injuries, if you talk about, especially in the high energy sports like the soccer, basketball,
cricket,
tennis, not cricket, tennis,
okay,
badminton, where the rotational movements of the knee are very high.
Okay.
So which will prone the knee, which will prone the ACL for the injuries. That is the reason, especially in these high energy sports, ACL is the very common structure which is torn compared to other structures. Okay.
So what are the symptoms normally that you would associate with ACL? Will there be any kind of pain or swelling? How does a person know whether he has got
when
ACL?
there is an ACL injury, the patients generally they present with the pain, and the patients feel as if the knee is popping out from the joint and then getting
so it will be a very severe pain,
yeah,
you
there
would
will
say.
be severe pain, along with the feel like the joint is popping out from the, the
coming out of
the knee joint, and then reducing by itself. And one more thing is, once the patient falls to the ground, the resumption of the activities will be difficult for him. Often the walking will be a bit difficult in the initial stages. After a couple of hours, the patients, many of the patients, they start developing swelling in the knee. Once we take out from the needle aspiration, it will be a blood collection in the knee. That is what we call hemarthrosis. So based upon these symptoms, we tell 70%, 70 to 80% of the times the patient injured is ACL. So we clinically assume is having ACL injury.
So once you suspect ACL, how do you confirm? What are the types of diagnosis methods used by the doctors normally to
So the
confirm
diagnosis based on clinical and the radiological methods. So clinically, the patient, we see the swelling in the knee.
Symptoms, pain and swelling.
Pain and swelling. And we do several tests. As I told you, one of the main function of the ACL is to prevent the translation movements. So there are several tests to test the translation movements like Latchman's pivot shift test, and there is an instrument what we call knee arthrometer. So we test the translation of the tibia onto the femur with the knee arthrometer. So these are the clinical symptoms and the test where we diagnose the ACL. And coming to the radiologically, we take X-ray of the knee joint to confirm if there is any bone injuries associated with the ACL. Okay, and if the X-ray doesn't show any bone injuries, then the another diagnostic modality is the MRI. So MRI gives the 100% diagnosis in case of
more
ACL
in depth
injuries.
and
Yeah.
okay.
So it is the 100% diagnostic tool what we have along with the clinical test on the
X-ray and all
X-ray.
that. Okay.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
And once it's been identified, then how do you go about managing this? If you could just talk about the management
diagnose
of ACL.
the ACL injury. So the managements we divide into two parts like non-surgical and surgically. If we talk about non-surgically, it is an option available to an individual who wish to modify his lifestyle changes, like who doesn't want to participate in high athletic activities. Then definitely non-operative intervention it plays a role. So coming to the other part, like surgical part, see, people should understand the ACL injuries are not the emergency procedures where we carry out immediately the day he has the ACL injury. So initially, before planning the surgical intervention, around 3 weeks prior to the surgery date, we advise the patient to do physiotherapy, like he has to regain the knee bending movements and quads strengthening exercises before we proceed for the surgery. Okay, and the surgery talk about here is because of the advances in the keyhole surgery, it is a knee arthroscopy. So arthroscopically, we reconstruct the damaged ligament. So the graft which we take about for the ACL reconstruction, there are two types of grafts depending upon the activity of the individual. So one we talk about is the bone patellar tendon graft. This is the graft we take about. Okay, and one more is the hamstrings graft. So these are the two grafts we take to reconstruct the ligament. So once we take the graft, we make a small tunnels, one in the lower down bone and the top bone, and then we fix it with the screws. So this is what is the keyhole surgery, the knee arthroscopic ACL reconstruction for the ACL injuries.
So this is done like a keyhole surgery.
Yeah.
It's not a completely open surgery.
No.
It's a
We make only the small cuts, like 1 centimeter cuts in the knee, and another small cut or 3 centimeter cut in the lower down bone to take the graft.
okay.
So other than that, there won't be any open wounds.
Okay, that's
Okay.
good. So normally you wait for 3 weeks. You give the
Yeah.
patient some kind of exercises
patient
so
has
that
to regain the
wait for
movements before undergoing for surgery.
surgery.
It is not like today patient had injury immediately.
And then tomorrow you can't do
It is not
that.
like a bone injury where we need to fix immediately. Patient has to regain the movements to have successful knee stability in terms of knee stability and the pain.
So what are the results of, what are the repercussions of an ACL injury? How does it affect a sports person? You spoke about loss of balance, stability and agility, but otherwise what are the other consequences?
See, other consequences, suppose if you don't do any, as per the studies, if you don't reconstruct the ACL, so there is, as I told you earlier, this is a cushion which is sandwiched between the two bones, that is meniscus, which is the shock absorber. So there will be a more damage to the meniscus and the surrounding ligaments like the MCL and the LCL. So when the meniscus tones, the working capacity of the knee joints comes down, and the patient over a period of time, it may lead to arthropfibrosis. That is what is called arthritis. So the degenerative changes in the knee. In short, you can understand the joint ages more when you don't reconstruct the ACL. Okay, the load distribution will be more on the joint without the ACL.
So the long-term impact is bad. They could develop arthritis or any other bone-related problems.
Because you lose the stability and the rotational movements will be more. See, knee joint is meant only for the bending movements. It has only one movement, okay, up and down. So when there is no ACL, the rotational forces will be more. So this puts stress on the other structures, which will damage the knee. So it ages faster, I mean to say.
So what about the rehabilitation procedure, doctor? I mean, is there any physiotherapy involved after the surgery is over?
Yeah. So once we done the keyhole surgery, so normally if we do only the ACL reconstruction without touching the other parts, so after 48 hours we mobilize the patient with the knee brace. So about 50% of the weight bearing we can put immediately after 48 hours of the surgery with the knee brace.
Okay, so they have to wear braces after this?
Brace, it will be there for next 3 weeks.
3 weeks, okay.
Once after 3 weeks, so we advise the patient to do physiotherapy to regain good knee bending movements and quadricep strengthening. And once the patient regains good strength and the knee movements, so he can perform better.
And how long does it take for the sports person to get back to a normal sporting activity? Is it a long recovery procedure process?
If the individual want to return sport activities, especially for high energy sports, normally it is around 6 months. So after 6 months, the patient definitely can return to his sporting activities. Before that, you need to have good range of knee motion. We expect the patient to have at least 130 to 140 degree of knee bending, along with a good around 80 to 85% of the strengthening in both the quadriceps and the hamstrings. So once the patients regain this range of motion and the strengthening with the hamstrings and the quads, then definitely you can participate in the sports after 6 months, not before that. Yeah.
Okay. So doctor, you spoke about arthroscopy, which is actually a keyhole surgery, but are there any other latest advances in this surgery, any other methods which are being used now?
Yeah, concerning the ACL, ACL we categorize into 4 types. There is 4 types of injury. I will show you in the knee model. So type 1, if we talk about the ACL will be torn from the top bone. That is what we call avulsion fracture. And the other 3 types, there will be a tear in the mid part of the ligament. So if we talk about recent advances, like normally we reconstruct the ligament. There are no studies supporting the repair of the ligament. So especially in type 1 ligament tear, so there are studies proving that the repair of the ligament helps in recovery. So how do we repair is just the native ligament, we suture it back to the femur and we make a holes in the top bone, so that whatever the stem cells in the bone marrow, it comes out to the joint and they help in the healing process. So this recent advances, the recent technique, it is only it is only for the type 1 ACL injuries, not for the other 3 types of injuries, where we don't have adequate studies to prove the repair of the ligament. is helpful than the reconstruction. Why? Because the ACL, it has blood supply, so naturally the healing capacity of the ACL is less. So the reconstruction plays a major role in the other types of the ACL.
Okay.
So reconstruction has far more better results than the repair of the ligament. Okay, repair definitely plays a role only in the type 1 injuries.
Okay, so reconstruction is more
Yeah.
viable option.
It is a viable option in the other types, like where there is a torn part in the middle part of the ligament.
Okay.
Okay, and these are the recent advance, one of the recent advances in ACL reconstruction.
So doctor, before we wrap up, any takeaway message for our viewers, if you could just explain in a nutshell what we discussed here today for the benefit.
So ACL injuries are very common in the high athletic sports like soccer, basketball, tennis and the badminton. So whenever the athletic individual has an knee injury while playing these sports, so better advice is to consult the physician at the earliest to evaluate the knee and to rule out the ACL injuries.
Thank you so much, doctor, for taking the time out to be with us and for explaining to us in detail about ACL. Really appreciate that. Thank you so much. Viewers, I hope all of you found this episode very informative. As doctor rightly said, ACL is treatable, it is curable. The sportsperson can go back to normal sporting activity 6 months after an ACL surgery. So please do take care of the injuries, visit a doctor. Till we meet again next time, this is Anupama signing off. Good night, stay healthy and stay happy.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.